More than 3 years since the start of the pandemic, there are still long waiting times at both hospitals and for in-home care. Stephanie Tsai explores how the medical staffing shortage is affecting patients and why nurses are leaving hospitals for other jobs.
Brendan, a first grader at an elementary school outside Phoenix, Arizona, has been through a lot in his young life. Even attending school is a victory.
Hey, here we go.
His claps suggest he's having a good day.
Brennan is 6, almost 7. He was born with half a heart, and he's got a lot of other medical complexities as well.
His mom, Lori Sang, says Brendan has had 21 surgeries and has been in and out of the hospital since he was born. But since the COVID pandemic, his care has suffered. Lori recalls a recent visit to a local children's hospital.
That was a respiratory issue. The last time I took him, we were in the ER for 21 hours before they could find a room for him because they didn't have enough beds and enough nurses.
When you finally did get care, did you feel like rushed?
You could tell that they were stressed themselves, and I don't blame them because, he was put in an ICU setting. They had more patients than they should have had, each nurse.
The national nursing shortage dates back decades, but the COVID-19 pandemic pushed it to crisis levels. One study predicts that in the next 2 years, there will be a shortage of up to 450,000 bedside nurses in the U.S. In countries around the world, medical workers are pleading for more support. Earlier this year, thousands of nurses in New York went on strike to protest their caseloads. In the UK, nurses and ambulance staff staged the largest protest in the National Health Service's history last month. And recently in Spain, hundreds of thousands of public health workers protested budget cuts. No organized protests, but an emergency department packed with patients at Valleywise Health, a public hospital in Arizona's largest county. Like many hospitals, they're having a hard time keeping and attracting nurses and other medical staff.
We've strived really hard to keep the beds open.
Chief Nursing Officer Sherry Stotler has been at Valleywise for over 18 years.
Exactly how severe is the shortage?
We're probably around 440 positions that we could fill.
440 positions are unfilled?
Right now, we're utilizing contract labor to cover a lot of those positions. They might stay a few rotations and then they move to the next state or job. So I think that for us, it puts a lot of pressure on us to have stability, foundation for the care we're providing.
Valleywise is so short-staffed, it has closed several behavioral health units. Patients are on a waiting list for care. Last year, Arizona ranked among the top 5 states with the most critical hospital staffing shortages. Many workers are leaving their permanent hospital jobs in search of less stressful work. The pandemic was brutal on frontline medical workers.
The patients were just very, very sick and just a lot of physical, mental, and emotional stress in the hospital for the patients and for the staff that's been caring for them.
Many quit, but Tian Leek, a single mother, stayed.
You're not getting quite as much break and not having as much time to spend with the patients and, just really being rushed to get things done and meet all the same obligations that you need to meet just to get the job done.
Leek was one of more than a dozen nurses who attended a recruiting event for a private nursing service.
So we can help fill that gap to make sure people get the care they need.
Jasmine Bhatti is the co-founder of Navi Nurses, which provides home nursing care on demand.
I'm hoping that with our new model of care, we can not only help retain the nursing workforce, but also provide people better health outcomes.
Bhatti herself was a practicing nurse until about 1.5 years ago.
I was just tired, exhausted, and definitely burnt out. My heart hurt from everything I'd seen and worked through.
Bhatti says she saw firsthand how high nurse-to-patient ratios could affect patients.
There was one night at work that I questioned whether or not nursing was for me. And it was because by 11 p.m., I hadn't been in to see 3 of my 5 patients. 2 of my patients I had to send off to the ICU. 1 almost died. it just makes you feel defeated.
And that's because there should have been enough nurses for you to only have to do 2 or 3, is what you're saying, not 5.
Right. Not at that level of care that these people required. It's not safe. It wasn't safe that night.
And the shortage also extends to home health care. Paula Skladany-Law suffers from multiple sclerosis and has needed a home nurse for several months to dress a wound on her lower back she can't reach. But finding reliable home nurses was difficult.
People should be able to get the treatment and the care that they need.
The Navi nurse that comes 4 times a week is a bright spot in her day.
Oh, perfect. 112/73.
Attentive, thorough, and experienced. But the service is not currently covered by insurance.
I have to pay for concierge nursing, which I didn't know was a thing before this happened to me. I went through my savings.
While Paula burns through her savings, Lori Sang is burning through vacation time, caring for son Brendan. The shortage of home health care nurses means that she's having to pull double duty.
I got to the point where I was taking so many days off, and just because we had no help, I was really worried about losing my job.
She still depends on therapists and other providers. It takes a caring team to give Brendan what he needs.
1, 2, 3. There's your hands.
But the team has shrunk. Brendan recently got pneumonia, and an anxious Lori decided not to go to the hospital.
We made the decision as a family, you know what, let's try to battle this here.
Caring for him at home seemed safer than going to an understaffed emergency department.
Has it overall affected his health, the gaps in nursing care that you would hope he would get?
I think had we had consistent nursing in home and in hospital settings, you know, maybe like those illnesses where they've come on and we've had to take him to the hospital, maybe that nurse would have like been able to catch it like ahead of time and be like, you know what, let's get him to the doctor now, let's get him on antibiotics, and we might have prevented those ER visits.
And Brendan's next medical emergency is never far from Lori's mind. For the PBS NewsHour, I'm Stephanie Sy in Maricopa County, Arizona.